Good evening. My name is Ben Atkins. I'm a general dental practitioner from Revive Dental Care. I just want to sort of give everybody an idea of who I am before I crack on with this webinar. I am the clinical director of 8 different contracts across the northwest of England. I'm a
The
trustee.
broadcast is now starting. All attendees are in listen-only mode.
I'm a trustee of the British Dental Health Foundation. I, for the past 8 years, have been the LDC chair for Salford. I've been on a representative body for the BDA for 3 years. One of my practices has a pilot contract for the NHS England. I'm a NICE clinical advisor and I have a DIPSI in restorative dentistry. I think it goes without saying, I don't feel this contract has started off on the right foot when it comes down to the staff who are being tupied over. I don't feel we've engaged with you properly. I don't really feel the staff have spoken to enough about who we are. And this is down really to the complexity of the existing contract for the staff. And I can only apologise how long it's taken for us to get around the legalities. On the flip side, we've got a service to run, and I feel there's going to be work for everybody. So, without further ado, I want to discuss why you're looking at a computer this evening. We've been trying to communicate, really, with approximately 200 people who we're going to have to work with on this service. Multiple training evenings at the moment really are unfeasible in the short time frame we've got to launch this process. We need to communicate with everybody quickly, and over the coming months we need to review the service, and we're going to be getting together anyway, because I need your help in saying what you think can be improved and what you think efficiencies can be made in the service. This lecture will be available at lunchtimes and evenings for the foreseeable future, so if you need to have a watch of it again, then please by all means do. Usually at a webinar you'd answer questions at the end, as in any other lecture. However, I really would like you to email me any questions so I can do an update in a couple of weeks' time. So it means that the same people aren't asking different questions that haven't been already answered before, and we can be a lot more streamlined when it comes to talking to you. Revive Dental Care has developed over the last 15 years. My mission statement is for all our patients to understand their mouths, preventative regimes and treatment. This gives some goals for my team. The team is to understand what the patient wants, and key to me personally is to demonstrate to the patient that we understand their wants and their needs. So I'm hoping this gives you the idea that Revive Dental Care is mainly about education of the patients and empowering the patient to look after themselves. So a quick overview of the new NHS out-of-hours dental service for Merseyside and for the Cheshire areas. Our out-of-hours service will be for patients who have pain which is not reversible by over-the-counter pain relief. That is to say that the patient has not taken the correct painkillers. They will be educated and turned away. Obviously, trauma, swelling and bleeding will be seen. However, often pain relief is the prime issue, and this has come from talking to the staff across all of our out-of-hours services. Often patients do not understand what they can take to alleviate their pain, and that's one of our jobs, especially with the triage service, to change this. My services are very much focused on treatment-led rather than prescriptions. I feel prescriptions are often delay the inevitability of having to complete dental work, and it also can result in multiple visits over a few years. So, but obviously we're going to be doing pulpotomies, simple, and I do mean simple extractions, trauma, obviously we're going to be splinting teeth and excising abscesses. The commissioners expect us to treat the patients and not give them a script. However, we must be aware that our prime focus is pain relief and getting the patient back in to see a dentist or their dentist the next working day. So I will be looking for all my clinical teams to actually treat the patient, and we will be monitoring prescriptions and working with the GDPs to develop different strategies on this. So what is the change in the patient journey? There's a few different avenues that patients can access the service through their dentist, their GDP. Now, as you see in a bit, we've been working with the LDCs to develop their answer phone message. 111, if a patient's got toothache, that's a good place to enter into our system, and they will be signposted to the triage telephone number. Or walking patient. Walking patients obviously come into your clinic at the moment, but from a lot of the feedback we've been having, a lot of these patients often don't fit the criteria of the out-of-hours dentist, and will have to be redirected into our triage service. The patients will be triaged. They will be sent to your location. You'll treat them, and you'll send them away in their merry way. So it's an evolution of the service that is currently being undertaken across the patch. As I said, we have been working with the local dental committees to develop a new answer phone message, and that is starting right from the beginning to educate the patients about what the service is there for. You'll see halfway down that it focuses on severe pain, not controlled by regular pain relief. Obviously, there's uncontrolled bleeding, swelling, dental trauma, and the patients are directed to the helpline where they can ask for assistance or advice. This has been developed closely with the LDC, and they have designed this message, and it focuses on the actual change in mindset that we have to deal with our patients and educate them on how to look after themselves. Patients, as I mentioned earlier, will be triaged. They will go through a number of questions. This process will be fully recorded, so we know patients will get through the net, and there's always learning outcomes. So part of what the dentist's role is to feed back on any patients they think, oh, do you know what, that patient didn't quite meet the criteria. Can we change this algorithm just to make sure that the correct patients get through? And we can focus on the patients who really need our help. The clinic setups. There's going to be 12 patients come down to each 3-hour session. Now, over the years, we've developed this system where the patients are given arrival times, not appointments. So this is an emergency service, and it's keen to communicate that to our patients. The first 4 slots generally will be rollable from the night before. They all arrive 15 minutes before the clinic starts. And then 2 more patients will turn up at 9:30, 2 at 10, and 4 at 10:30. This will mean that you then know if any patients have failed, which we would be expected to contact the triage service of more patients. It would mean that you will be able to manage your patients a lot easier, because if someone is late, you can pull one of the other patients in, so you're not having to have difficult conversations with patients. And it will mean your service is a lot more efficient, but more patients will be able to be seen as a result. After every session, there is a feedback form to fill out, and self-monitoring of the perception of your profile of how many prescriptions you've given out. The stats for the service have been very poor over the last 4 or 5 years, and the commissioners do not really know the call volume or the patient volumes that have been seen on the service. It's not to say that services haven't been busy, it's to say that this hasn't been reported to the commissioners. So the service will be under review over the next few months to review activity, and we will then sit with the commissioners to say what activities actually need to be completed. A key complaint from local dentists is we need to fill a feedback form to give to the patient so they can take to the dentist to say what they've actually had done to them. Now, there's been a short little talk. I have only just started using this webinar magic that's in front of us, so I do apologise that I couldn't get my webcam to see my ugly mug whilst we've been talking, but that is my email address, my personal mobile. If you use Twitter, I'm more than happy to speak you through that, or Facebook, or carrier pigeons, whatever you'd like. That's me again with my bees, and I hope to have a face-to-face contact with you over the next coming weeks. You'll get a phone call from me, hopefully the week before you're about to work with us, and we'll catch up more from there. So if you do have any comments, please email me, and we will endeavour to do another one of these again in a couple of weeks' time. In the meantime, Pam, Deb, and Faye will be doing some more webinars about the mundanes of being paid and uniforms and CRB checks and all that sort of thing.